Oh, good, they're putting their slides, the things down. I love how those shades come down, right? Very nice. I love that. Good morning. I love that you all said good morning back. That's so nice. Because this is voices, so we want to hear your voice, right? Good. So my name's Mairead Painter. I'm the State Long-Term Care Ombudsman. My preferred pronouns are she and her. I want to welcome you all today to our annual Voices Forum. I'm so happy to be with you all in person. It took a great deal for us to be able to get here today and to return to being in person. And I know there are some individuals that are going to have to watch this remotely that weren't able to join us because of health issues and concerns within their facilities, but we are recording this, and so if individuals would like, you can download it from our website. I want to acknowledge some people here today that helped make this happen. One is my team, so if the regional ombudsman could please stand up and come out, as well as the intake coordinators, who I think are out in the hall, Stephanie and Deb. So you'll see Dan Beam is right here. Brenda is at the back. I don't have my glasses on. I see Tasha, Sylvia, Lindsay, and where are Deb and Stephanie? Maybe they're coming. Also, I want to thank Andre, I don't know where Andre is sitting. Andre, my administrative assistant, who is no longer my administrative assistant, but still did a ton of work to help pull today off. And Capshaw from the Commissioner's Office, and I think they're all hiding out in the hallway. But Capshaw also a huge help. I also want to recognize our volunteers, our resident advocates. So if you're a resident advocate, please stand up. For all the work you do in the nursing homes. And our students. We have several students this year that are working with the program. So you can stand up doubly. Thank you. And a couple of the students weren't able to be here today, but thank you. We also have two nurses joining us today. We have Kim Hrisniak. Kim standing in the back. And Benil St. Jean. So if you need anything or you have any concerns, please let the nurses know. We have bathrooms here to my left. We are not going to be taking a break today. Please don't worry. If you need anything, just get up, get something to drink, use the ladies' room at any point, okay? Now, we're all here today to champion the voice of individuals in nursing homes and receiving long-term services and supports. After 3 long years, we have all persevered, and I do mean all of us. Everyone here, residents, family members, nursing home care team members, state team members, volunteers, students, and advocates. We've all overcome a great deal. I want you to know that every voice matters, and we're here to improve the quality of care by listening to what you have to say and ensuring that you have the most up-to-date information regarding nursing homes. The importance of your voice has also been supported by our legislature, and one example of that is the passing of Public Act 21-194, an act strengthening the voice of resident and family councils. This act ensures that there is an opportunity to have testimony from the statewide coalition of presidents of resident council, and we have 2 of our presidents of resident council coalition members here today. Do you guys want to just wave your, you don't have to get up, just wave your hand. Patty. Thank you. And that resident councils and family councils have the opportunity to speak to such legislative proposals and proposed regulations. It provides for the opportunity to have residents and family members participate in any state task force appointed by the General Assembly or state agency to study issues concerning living or care conditions in long-term care facilities. These are huge gains, and we are one of the only states in the country to have regulations like these in place. Choosing to receive your long-term services and supports in a nursing home does not mean that you do not or cannot have say in the way that the long-term care community looks and provides care to everyone living there. As the world of long-term services and supports changes, they've made advancements, and it's incredibly important that we hear your voice and that you're part of that change. The voice of residents at this forum has addressed legislators, policymakers, care providers, and has called attention to really important issues like the personal needs allowance, which we were able to have increased. Fear of retaliation, yes, that's a big one, right? Yay! Fear of retaliation, nursing home staffing levels, residents' rights, and general quality of care. We want to ensure that all nursing home residents have access to unbiased information related to their long-term services and supports, what's available to them, and the way that you receive quality of care in the setting of your choosing. We want to champion the continued advancements in person-centered care, technology, and what good quality of care looks like to you. Today, our theme is back to basics. We thought this was important because many of the complaints and concerns that we've been receiving this year are really related to basic care needs and the ability for residents to ensure that their care is person-centered. We're going to have a presentation today by Lindsay, one of the regional ombudsmen, to explain more about person-centered care, ensuring that your care and services are provided in a way that's directed by you, that you have the opportunity to lay out what your best day looks like, what your goals are, and who are the important people in your life who help you reach those goals. We're fortunate to have some incredibly high-quality nursing homes here in our state. However, we have to ensure that all residents have access to high-quality homes, and it's not just because that's where they ended up being able to go. We want Connecticut's nursing homes to continue to improve and thrive, providing the highest quality of care. So how do we get there? We share best practices, we learn from each other's experiences, we provide education, and we advocate. We hold poor performers accountable and support providers who are putting people over profits. We want to set an expectation of excellence in the care and give the voice to you. Tell us what's going well, and then tell us where you see a need for continued improvement. Today, we are joined by elected officials, agency heads, policymakers, advocates, and industry representatives. They're all here because they want to hear from you. They want to know what's going on and how we can have that level of accountability and create the change that you all want to see. This legislative session will continue to advocate for staffing, accountability, transparency related to ownership and finances, access to the greater community for you all, and improved quality standards. I promise to continue to work on your behalf, looking deeper, asking the hard questions, and pressing for improved outcomes. I'm grateful for all of the partners here joining us today who share our vision to improve the lives for all residents. With that, I would like to present one of our biggest supporters, a true advocate for older adults and individuals with disabilities here in Connecticut, and I'd like to welcome Commissioner Porter.
Good morning, everyone. How's everyone doing today? Good? Good, good. Whose voice did I hear someone say, you're going to hear mine all day? Who was that over there? Oh, okay. I didn't hear you answer me, so I'm just checking out. So, Marie, thank you so much for inviting me today, and thank you to you and your team. This is such an incredible event. It's an event I look forward to. I used to look forward to it every year, and then we weren't able to do it in person. So it is so nice to see all of you, to be here. As Marie had said, our job today is really to listen, to hear your voices, to hear what's working, to hear what we need to think about a little bit differently. And the Back to Basics theme really makes a lot of sense. We have learned so much as we endured through the pandemic. I think all of you have lessons to share. You have things that you want all of us to hear. And I think we've all learned together some things that we need to think about differently. So we're here today to listen to you, to hear your ideas, to hear your experiences, to celebrate with you what is working really well, and to really help guide us as we think about what the future looks like for all of us. So I'm looking forward to the day, and I just want to say good morning and welcome to everybody, and thank you very much.
Just stand up here versus walking back and forth up that ramp. Now I'd like to welcome Lindsay. Lindsay Jessup is one of our regional long-term care ombudsmen, and she is going to offer a presentation today on care planning basics. So come on up, Lindsay. You need a carpet on there.
I can tell how much I weigh from that one. Good morning, everyone. Good morning. The Voices Forum has always been one of my most favorite days of the year, so nothing makes me happier to be here with you all today in person. Thank you for attending and for reigniting the magic that is Voices, a day where people are brought together so that your collective voices can be heard and, more importantly, voiced. So thank you again for attending. I know it's been a bright and early start for many of you, and we are just so thrilled to have you all here with us. For those of you that live in a nursing home, you experienced yet endured the COVID-19 pandemic like no other group. For the past almost 3 years, you have been inundated with information pertaining to certain protocol, practices, laws dealing with infection control, visitation, testing, the list goes on and on. And we know that that information was very overwhelming and ever-changing. So, as Maraith mentioned, this year we really wanted to bring it back to basics and talk about some of the key elements that you as resident council presidents and representatives of your resident council can bring back to your fellow residents, and basic things that you as residents should expect from your nursing home and your care there. So again, my name is Lindsay Jessup, and I am delighted to be here with you today to talk to you about the basics of care planning. All right, so we'll start off with what is a care plan? In the shortest sense of the term, a care plan is a tool utilized by the nursing home that details what a person's needs are and what services a person in the nursing home will receive. Care plans are required for all individuals living in the nursing home, regardless of a person's length of stay at the nursing home. So you could be at the nursing home for 1 week and you will have a care plan. You could be a person living in a nursing home and getting your long-term services and supports on a longer-term basis, and you will also have a care plan in place. So what information gets included in a care plan? Well, there's a lot. And it starts with what kind of services an individual may need or benefit from. So that could be things like any specialized therapy a person receives, physical therapy, occupational therapy, speech therapy. Which healthcare providers will provide the service? Who a person's doctor will be? Will they have any outside providers coming in to provide services, such as a podiatrist or a wound specialist, a psychiatrist? How often an individual will require or need the service? What type of supplies or equipment will be needed to appropriately care for the person? That could be anything from a specialized mattress or a brace that goes on a person's arm to specialized equipment that a resident or an individual uses to complete their activities of daily living, such as a rollator walker or a motorized wheelchair. What medication a person takes and when they receive them, any special dietary requirements that a person may have. Is it recommended that they be on a high-protein diet? Will there be any specialized supplements that a person takes? And the consistency of the food in which they eat. And then lastly, a person's goals and how the plan will assist someone in reaching his or her goals. Apart from the last bullet, it's all very standardized information, wouldn't you say? It's very straightforward, and there's an emphasis on the medical information. So what's missing? While all that medical information is certainly necessary, what's missing is the inclusion of the person. What do they want in their care? What do they want from their care? Who would they like providing their care to them? In essence, ensuring that the person is at the center of their care and is taking the most active role in their care rather than a passive role is certainly what's missing from those standardized elements that we just spoke about. So when person-centered care is adopted into one's plan of care, we can expect some of these elements and outcomes. It promotes positive well-being. It honors a person's choice. It enhances someone's dignity. It empowers people to take an active role in their care. It improves the quality of life that a person has, and it supports their independence. So we kind of talked about some of the elements and what we can expect from person-centered care planning, but what is person-centered care? So the American Geriatric Society in 2015 had an expert panel of 14 individuals from different backgrounds: geriatricians, gerontologists, social workers, public health professionals, public policy, people who were involved in law, and they kind of came up with a definition of person-centered care. What's interesting to me now, 7 years later, is that an actual person who receives care or has a care plan in place wasn't included in that panel. I think now, years on, we would always make sure that there's a person who's living that experience is included in definitions that are getting created. So the definition that they came up with is person-centered care means that individuals' values and preferences are elicited, and once expressed, guide all aspects of their health care, supporting their realistic health and life goals. Person-centered care is achieved through a dynamic relationship among individuals, others who are important to them, and all relevant providers. This collaboration informs decision-making to the extent that the individual desires. So why is it important to incorporate person-centeredness into care planning? You as individuals who receive your long-term services and supports in a nursing home can probably come up with many more reasons than what's listed here, but these are just a few. So, for one, the person establishes their care and the services and how they are received. The emphasis is not purely medical, but also focuses on the person's environment, culture, perceptions, and quality of life and experiences. I think that's really important to remember, especially for a person who may be living in a nursing home on a longer-term basis. That nursing home becomes a culture. It's an environment. A person's experiences at the nursing home impact who they are and the care that they receive. So I think it's very important that we make sure that we are mindful of the environment in which someone is living and try to incorporate that into their plan of care. It also creates a pathway for continuous collaboration, communication between the person, their desired support persons, and the interdisciplinary team. And it inherently integrates an individual's right to choice, risk, dignity, and respect. So, preferences that we should consider. When we're working towards a person-centered care plan, one's daily routine, desired schedule. So in the most basic form, when someone chooses to get up in the morning, when they choose to have their breakfast, when they choose to get assistance with getting out of bed, if they need that assistance, and what time a person would like to go to bed or get assistance with going to bed. So again, working someone's daily routine and desired schedule into the plan of care. Meal preferences, and not just the dietary requirements that we talked about in the beginning, but what someone's likes and dislikes are, and making sure that's explicit in the care plan. Because there's nothing worse than being served something that you don't like over and over again. And has that happened to anybody? I mean, it's even happened to me sometimes at restaurants when you say, please don't give me tomatoes, and then your salad comes with tomatoes. So that's very important. Your interest, your desired activities, any religious and cultural practices that a person has are so critical to ensure that we're embracing in a person's plan of care. And again, preference in providers and caregivers. Who a person's doctor is, making sure someone knows that they have choice in which doctor they see. If someone would like to see specialists in the community, making sure that people have choice in who that specialist is, where that specialist is located, which practice or hospital they're affiliated with. And making sure that individuals know that they can always change that doctor should they wish. There should never be just one person that you have to have because that's all the nursing home has on staff. There should always be some choice, and you as residents always have the right to request second opinions. So I know that this form is a little hard to see up on the screen, but you do have some binders, which I'll go over at the end of the presentation. It is in your binder in the second section, which is all of your care planning information. But it's a form that a person can fill out prior to attending a care plan meeting that helps create and ensure a pathway to person-centered care. And it's also a tool that can be used in a person's room. There's nothing here that's specifically medical, HIPAA related. It's all about the person. It uses person-centered language. I feel safe when these things happen. I like to eat these things. So you will see this form in your binder. It will also be posted on our website after the forum, and you can go to it, refer to it, print it out, and use it. And just a plug, I think it's great, a great tool to have in somebody's room, because the direct care staff probably spend the most time with an individual throughout the day, and if they are truly learning what makes a person whole and what a person likes and doesn't like, it's going to anticipate someone's needs much better, and again, it's going to enhance that person to feel empowered to ask for certain things and improve their quality of life and care at the nursing home. So, what is a care plan meeting? A care plan meeting is a time for an individual, an individual's desired support persons, and the nursing home care team to review all components of a person's life and care at the nursing home. The meeting allows for a person to share information about how things have been going, express any concerns or questions, and a very important part is that participation in care plan meetings helps to integrate person-centered planning, which can assist in achieving quality care. So for individuals being present at that care plan meeting, and if they can't, having a family member who knows the person, it's so important for them to be at these meetings, because if they're establishing person-centered care based on what someone likes or what they don't like and their preferences, it's ultimately going to enhance that person's quality of care. So, when are care plans developed and how often are care plan meetings? So, a baseline care plan meeting is done within 48 hours of admission to the nursing home, and a written summary needs to be provided to the person, their desired support person or representative. The baseline care plan also includes other information information such as physician orders, therapy services, dietary requirements, as well as what social service supports a person will need. From there, a comprehensive assessment is done within 14 days of admission, and after the comprehensive assessment, a comprehensive care plan is developed within 7 days. So if all goes well and all goes correctly, within 21 days of being at the nursing home, a person should have a comprehensive plan of care in place. Again, reviews, quarterly assessments are done every 3 months, and care plan meetings are done every 3 months or when there is a major change in someone's condition. However, that being said, care plans are living documents. Plans of care can always be changed or amended. It's not something that is ever set in stone. It's ever evolving and ever changing. And I want you as resident council presidents and representatives of your council to know that and bring that back to your fellow residents, that a care plan can always be changed, especially in terms of someone's preferences or daily routine or desired schedule. And you, as a person who receives your long-term services and supports in a nursing home, also always has the right to request a meeting to discuss care and address any questions or concerns you may have. Do not feel like you have to wait 90 days to have a concern or question answered. If you have something that you want to address, you can always request a meeting. So the next 2 slides are really just examples of a care plan meeting request form as well as a care plan invitation. There's not much to it in terms of the details that go in it, but it's a form that we developed. There's a fillable option that will also be on our website. There's great things in there like what the reason for the request is and who you would like at your meeting, the proposed date and time, when you'd like to have this meeting, questions to address. That can be done as you request the meeting. The next slide is an invitation to the meeting. And again, it's the day and time of the meeting. Who's been confirmed to attend? Is there a link to attend virtually? If the pandemic has taught us anything, it's that we can be virtually connected. So if you have friends or family who you would like at a meeting, who can't be there in person, making sure there's a link that the person can attend virtually or a telephone conference number to dial in. So perhaps this is standard practice at some of your nursing homes, perhaps it isn't. But what I'd like to impress upon you as individuals who are living in nursing homes is bring this back, bring it to your resident council, see if it's something you feel could be adopted, and also to the staff that are here, if you don't have any kind of formal requests or formal invitations that you're using, consider something of this. And again, this was very easy to create and it doesn't have to be used as is. You can amend it to your home based on your home's kind of community and how you do things. It might take some organization in the beginning and some oversight during implementation, but once you get it off the ground and it becomes a standard practice for you at your home, you're going to see that things run much more efficiently when it comes to care plan meetings, because everybody is going to know to expect it. So again, I think that's a great tool to use and that you can adopt, and something that will show to be beneficial and actually time-saving down the line. And just some best practices for care plan meetings. We touched on some of these things already, but before the meeting, if the time doesn't work for you or your desired support person can't attend, request a different time. It doesn't have to be the time that was written on the letter. You can request a different time. A suggestion to residents is to request a copy of your current plan of care, list of medications, so you can review it prior to the meeting. If there's certain people you want at your care plan meeting, invite them ahead of time. Sometimes someone would like their doctor or APRN there. That's great. If the doctor or the APRN can't be present, perhaps having them give a little written summary in preparation for the care plan meeting that talks about what you've been working on, what some of the recommendations have been. And meetings don't have to be 15 minutes. We hear that often. Usually they are, right? But if you feel like you're going to need a little bit longer of time to discuss your care plan and your person-centered care plan, request that it be a little longer so staff can arrange for that. During the meeting, carefully review your preferences. Remember, your preferences getting put into your plan of care is what's going to drive that person-centered care. Discuss any plans or goals that you have for discharge or interventions that you'd like to see at your home. What other services could potentially be offered to you? And if your questions have not been answered throughout your care plan or during the time frame in which you have, request a day and time to follow up with key personnel and get that day and time in writing before you leave the meeting so everybody knows to expect this. After your meeting, request a copy of the care plan and make sure that what you discussed in your care plan meeting in terms of preferences and routine and schedule and your likes and your dislikes are all in your plan of care. Then determine if your plan of care is being met. So if you express during your care plan that you would like to be up between 10 and 11, and some days you're being assisted to get up at 8:30 or noon or whatever, what have you, make note of that so you can go back to your care team and say, this is what we spoke about and it's not happening, so how can we address it so that it is? And then request a follow-up meeting if needed. The last point I'd like to make is that person-centered care planning is wonderful, but it's not something the nursing home ought to be doing. It's something that they have to be doing. It's not negotiable. So again, you as resident council presidents and resident representatives of your resident council, please go back and make sure that your fellow residents know that person-centered care planning is a requirement. It's not something that can be done or cannot be done. No, it's something that should be being done at all times. So there's just a couple of pages for additional resources there that you'll find on our website. The PowerPoint will be there. The last thing I just want to mention is that all residents should have received a binder. In the front of your binder, you will see some letters from our statewide coalition of presidents of resident council about what the binder is, why resident council is important. The first section is all about resident council, and we're going to hear from one of our executive board members later today, John, who's going to give you an overview of resident council. But the second section has all of the information related to care planning, including some of these forms that we went over. So if you want to make copies, it's there for you. And then there's just some additional detail from some of our great national partners with information on care planning and person-centered care planning. So again, it's been such a delight to be here with you today, and I really hope you enjoy the day as well as your weekend. Thank you.
Okay, just gonna jump. Thank you, Lindsay. That was awesome. A few things I want to touch on that Lindsay brought up. This is a new experience for some of you. When we're talking about resident representatives, we used to say responsible party, right? So I would say a newer term, or the way that we want to identify that someone may not be responsible for you, right? But they're your representative. They're representing your wishes, your concerns, your needs, if for some reason you're not able to do so. So that's one thing. The second thing is, and we've talked about it in past years, and I want to thank our partners here from DPH and DSS, and also the associations, because we worked to promote here in Connecticut, again, one of the first states to have an essential support person. So as part of your care plan, it's really important that you take the opportunity to identify a primary and a secondary essential support person who knows what your wishes are, who can support you in a time of need, and will have access to you at times when there may not be open access. So if you want more information about that, you can ask the regional ombudsman to come give a presentation at your home during resident council. But that is something that they'll begin to review with you as part of your care plan meeting, okay? So next, this is a really special part of the program every year, and we give 2 awards every year. One of them is called the Carol Rosenwald Spirit of Advocacy Award. And this forum actually began out of an idea that Carol Rosenwald had in 1996. And her idea was that the voices of residents needed to be heard beyond the walls of their facilities. She became the founder of the statewide coalition of residents of Resident Councils, and she really drove home that nursing homes have large groups of constituents who are voting members in the community who need to be heard on topics and concerns that impact their lives. So we've made a lot of progress since 1996, and this forum has happened every year, even virtually, to make sure that that happens. So with that, I would like to invite Nora Duncan up. So Nora Duncan is the executive director at AARP Connecticut, and she has been an amazing partner, as well as everyone at AARP, not only through the pandemic, but we've been long-standing partners in volunteerism and just a lot of work that we do. So I want to welcome you to say a few words this morning.
Thank you. Hi, everybody. It's great to see people in person. It has been a tremendous challenge for all of you, more so than, I mean, the pandemic has been a challenge for everyone, right? You guys really went through it, and you persevered, and you came out with legislation that's better, with rights that are more enhanced, and with, you know, people who recognize how you live all the time. And there are many people involved in how this all goes, and I need to see this for a second. And what I want to do personally is thank all of you for honoring Anna Doragazi with this year's award. Anna is on my team, and she is our advocacy and outreach director, and she fought really hard alongside Mairead and many others of you in the room. And I know that the resident councils really wanted to make sure that Anna was honored for her work. And so I'm going to invite Anna up here to receive her award and say a few words.
And yay, we surprised her. So Anna has been working with our e-board, as we affectionately call them. Anna's been working with our e-board over the past few years on how to reach out to legislators, how to advocate. She's spent time with them and meeting with them at our office in person to coach them through things. So they have absolutely so appreciated everything that you've done, and we couldn't think of anybody who deserved the Spirit of Advocacy Award more than you. So thank you.
Well, thank you so much. It's surprising to be up here, but I really appreciate having had the opportunity to work with the Residents Council, to work with so many people in this room, including our great AARP volunteers, including Mairead. It is truly a privilege to be a steward of your stories and to be able to advocate on behalf of residents and family members. And I guess, I thought I was here today, actually. I have a handful of remarks here that have nothing to do with me, because I was planning to surprise Mairead Painter with AARP's Long-Term Care Champion Award. So turnabout is fair play, and as much as I deeply appreciate receiving the Spirit of Advocacy Award, I would also like to say, at AARP, our mission is to empower people to choose how they live as they age. And our Long-Term Care Champion Award honors an individual who champions choice, dignity, and quality in any setting where someone chooses to receive care. So haha, Mairead, I'm making this about you. And it's really difficult to imagine someone who fights harder for these principles and someone who advocates more effectively than Mairead. I'm sure everyone in this room is aware of how great Mairead is, but in the Capitol, she's informed, she's smart, she's steady and tenacious, and perhaps more importantly, she's a listener and a teacher and someone who cares deeply about the lives of nursing home residents, family members, and staff. We talk a lot and spend a lot of time in the same meetings, and I don't think we've ever had a conversation where you haven't kept resident needs and experiences and stories really as your guiding star. And I'm honored to receive this award, and I'm also honored to present you with an award. So,
And thank you so much. This means, and I'll talk to you. I'll talk to you later.
But Nora's in trouble.
Nora's in trouble with both of us now. Thank you so much. Like I said, the partnership that we have with AARP, and the beauty of it is that we don't always align perfectly on everything, but when you can have those hard conversations with partners where you see things differently, we all have different roles, and you can honor that, but that at a core, you're all seeking the same thing, which is good quality care for the individuals we serve here in Connecticut. I can't think of better partners than the individuals we have joining us here today. I also want to say that I'm extremely thrilled that I'm sad that Tom, my co-chair of the Right Size Rebalancing Steering Committee, which is like the longest name for a steering committee, he finished his term in September, and my new co-chair is Anna, so we'll get to spend even more time together. So thank you.
Oh, thank you.
I appreciate that. That's so sweet. Wow, thank you. That was surprising. People don't usually get me, so, All right. So our next award is an award that's really special to us. We had a member of our e-board named Brian Capshaw, who many of you know and met, and Brian was a resident in a nursing home here in Connecticut that found ways to get himself to Washington, D.C. to testify. There were a few conferences where I was like, oh my gosh, he decided to come out. He goes out to dinner. He's a nursing home resident. Do we have to worry about that? And he was like, look, I got this. I'm my own person. I signed out LOA. I made it to DC. And Brian was a rock star. He loved rock music. His room had a lot of memorabilia in it and guitars. And so Brian did so much at a national level that we decided to have a Brian Capshaw Rockstar Award. And this year, that award is going to Richard Malott. And I have a note here from the state ombudsman in his state, which is New York. And it says, I would like to congratulate Richard for being chosen to receive the Brian Capshaw Rockstar Award. As the executive director of the Long-Term Care Community Coalition, Richard has been steadfast in his advocacy for improving the quality of care for residents in long-term care facilities. As the host agency of 2 local ombudsman programs in New York, Richard and his organization have provided many trainings, resources for ombudsmen, and taught them ways to use their advocacy to benefit residents. She's worked with Richard for over 5 years and has witnessed firsthand his dedication to improving the quality of lives for residents in long-term care. He truly deserves this award for his work in his field and at a national level. And Richard has done a great deal of work related to staffing and presented maybe some information that you all have seen online. And so we wanted to honor him. He was not able to be here today, but he did give us a video.
Well, thank you so much, and I'm so sorry that I'm not able to join you all today. I am truly honored to be honored by the Council of Presidents of Resident Councils and by the Connecticut Long-Term Care Ombudsman Program. To be recognized by residents and by the Ombudsman is truly something special to me. I mean, everything we do, of course, is to support residents and resident-centered advocacy. And the fact that our materials and our work is useful to residents directly is profoundly meaningful to me. So thank you for that. I also want to say that it's really, really special to be receiving an award that is named for Brian Capshaw, who is a hero of mine and someone that I miss seeing at the Consumer Voice conferences. He was just an exceptional person and an exceptional advocate, and it means that much more to be receiving this honor in his name. So again, thank you. I am so grateful for this award and so grateful that you're able to use our materials for your own advocacy.
So what was really special is that when we went to give him the award and talk to him about it, I didn't know that he had spent time with Brian. So that was like 10 years ago that Brian went to DC now, if I'm thinking back, that they actually knew each other. And he got very emotional at the fact that it was named after Brian because of the work Brian did. So that was even more special. So right now, I have the privilege of introducing David Peck. And David is one of our e-board members, and he is going, oh, no, I'm sorry, David was not able to join us today because of an illness, so he's not going to be able to come, but he wanted to make sure you still got your legislative update. And the person giving you the legislative update today, it's recorded, but is Dan Lerman, and Dan Lerman has retired. For all of you who had Dan for a very long time as your regional ombudsman. We are fortunate to have him back with us working as a temporary worker retiree, so you may see him at times. He's going to be doing training of resident advocates, as well as new team members as we hopefully start to be able to hire. So you may still see Dan around, but he's here to give us our legislative update today. And I have to laugh because it's Dan.
I'm delighted to participate virtually at the Voices Forum and provide a brief big picture Connecticut legislative update. First, congratulations to e-board members, resident council leaders, and all other attendees for your advocacy efforts to protect and ensure resident rights and ensure and maximize quality of life and quality of care for nursing home and long-term care residents. I'm going to be going over a number of bills today, including House Bill 5313, 5485, 5500, 5506, Senate Bill 9, 173, 286, 5205, and Senate Bill 217. A brief overview. This was an every other year short legislative session. Both state chambers, the House and the Senate, continued to have large Democratic majorities with a Democratic governor. Children's mental health issues were top priority this year compared to nursing homes last year. There was a large state budget surplus and large rainy day fund versus major budget challenges a few years ago. There was lots of federal and state pandemic support to nursing homes, residents, and staff the last couple years. There were positive legislative advances on long-term care issues this legislative session, though not the landmark advances of pandemic legislative relief last year, such as staffing increase, personal needs allowance increase, essential caregiver, statewide visitation policy, use of technology of one's choice, social and emotional needs of residents emphasized, and many nursing home operational and infection control, resident council, and family council rights and requirements. This year, greater consumer protection measures and rights, accountability, social work staffing clarification, and reporting requirements and timelines. Let's take a look at a few specific bills. House Bill 5313. This provides for new accountability for temporary nurse staffing agencies and reporting requirements and possible future review of price caps. The concerns over the last year plus have been extremely high cost and the staff dedication, turnover, accountability, and customer service at times. Involuntary discharge notices will now be required to be submitted to the Ombudsman Program electronic portal for nursing home and residential care home discharges for better knowledge, timely advocacy, and tracking of discharges. There's added elder abuse training requirements. The Department of Social Services will be required to send out a notice to long-term care Medicaid applicants regarding their right to get legal advice before submitting the application. And a task force group on managed residential communities was approved and is chaired by our state ombudsman, Maraith Painter. And the focus is to provide greater consumer protections by reviewing timelines on fee increase notices and rights regarding care level transitions at the assisted living facility or need for higher level care. The next bill, House Bill 5485, includes 2 new training requirements. It provides annual minimum of 2 hours of training in pain recognition and administration, and it provides a minimum of 1 hour training in oral health and oral hygiene. The oral training is an expansion of current requirements. House Bill 5500, one of the aircraft carrier DPH bills where they recommend various revisions to the public health statutes, include a number of measures, including enhanced strike contingency staff planning information required to be submitted to DPH before a potential strike, more detailed information. There are new nursing home administrator CEU requirements on infection control, keep us all safe. There's nursing home social work staffing requirements that are now prorated after 60 residents. For example, if there were 90 residents, then there would be 1.5 full-time equivalent social workers rather than waiting for a second required social worker at 120 beds. There are some revisions to infection control prevention staff requirements with DPH approval at common campuses and other situations. A second task force has been approved on assisted living dementia special care units, and this will review whether additional DPH oversight is required, whether minimum staffing levels for such agencies should be required, and a review of maintenance of records by such agencies regarding meals, bathing, administration of medications, etc. Other measures in 5500 included the Connecticut Home Care Program for the Elderly, CHCPE. The copay was reduced from 4.5% to 3%. Just a number of years ago, it was 9%. Also, the state maximum spousal protection in the community for a community spouse has increased from at least $27,000 or so to at least $50,000 or so. Switching to 2 budget bills, House Bill 5506 and Senate Bill 9 include provisions regarding the Community Ombudsman Program. The Community Ombudsman Program has been supported with a program supervisor position to review development options for a full-fledged Community Ombudsman Program, hopefully in the near future. Senate Bill 173 just takes the community spousal protections further with a study to see if greater protections can be provided. Senate Bill 286 includes 3 key measures. Number 1, it shortens reporting deadlines for elder abuse. It reduces from 72 hours to 24 hours mandated reporting timeframes for elderly protective services, and it adds a training requirement for violators. There are penalties. The second measure, penalties for unauthorized use of rate increases earmarked for nursing home staff wage enhancements. This allows DSS to assess a civil penalty on a nursing home that receives a rate increase to enhance its employee wages but fails to use it for that purpose. The third key measure in this bill, certificates of need for long-term care facilities. Various changes are made, but one of the important ones, it provides authorization for DSS to approve requests to build non-traditional small house style nursing homes under certain conditions, more person-centered care focus. House Bill 5205, fair rent commissions. This would provide an expansion of fair rent commissions to multiple additional towns across the state with certain minimum population size. There'd be increased review of rent increases and tenant needs. Just this week in the New Haven region, the New Haven Register newspaper has had 2 front page feature articles regarding tenant unions formed, not at senior housing, at apartment complexes, market rate apartment complexes in Hamden and in New Haven, in efforts by those tenants to approach the Hamden and New Haven Fair Rent Commissions to seek relief. Also, New Haven has been, the city of New Haven, the mayor, the administration have been very supportive of the Fair Rent Commission, and Hamden is moving forward with actively moving forward on the Fair Rent Commission also. Senate Bill 217, establish a hate crimes investigation unit within the state police, is an important bill because it highlights the last few years' efforts on equity, diversity, inclusive communities, protecting individuals from bias for ethnic, race, religion, gender identity, sex, or other reasons. In addition, there were expansions of voter registration and absentee ballot rights, and the increase in minimum wage continued to roll out. Those are some key state measures. On the federal level, let's take a quick look at the White House National Nursing Home Reform Plan that was issued in February of this year. It lists goals and plans. I'm going to list some of them. Adequate staffing, poor performing nursing homes held accountable, establish a national minimum staffing requirement, reduce resident room crowding, strengthen nursing home value-based purchasing quality performance, or in simple language, better quality, better pay. Reinforce safeguards against unnecessary medications and treatment, adequately fund inspection activities, beef up scrutiny on more of the poorest performers, expand financial penalties and other enforcement actions, improve transparency of facility ownership and finances, and continue with strong requirements for pandemic and emergency preparedness. Ambitious, bold, controversial due to cost and who pays. There's been pushback from the industry regarding potential cost of a national minimum staffing plan. Strong advocacy support is needed to help get many of these measures over the finish line. In Connecticut, for 2023, the legislative agenda may include items such as continued staffing measures, transparency of ownership and financial reports, adequate financial and staff resources for the Department of Public Health and Department of Social Services to ensure their enforcement and financial review roles, continued public information made easily accessible and available for consumers to best evaluate and understand nursing homes and other issues. We provided the big picture overview. We've summarized some key nursing home and long-term care state legislation passed this session. We've mentioned some federal initiatives that will help improve long-term care for our residents, and we've discussed some possible 2023 other legislative goals on the state level. There have been positive achievements in the 2022 legislative session. Best advocacy wishes for 2023 to all. Thank you.
I don't know if you can tell, but Dan's really into legislation. And I'm actually a little nervous that Dan retired because he normally would sign on in the morning by about 6:45, and by 7 he would give me an update of the 2 or 3 newspapers he had already read. And in the morning I would get and Dan's laughing because we would get this run of anything long-term care that had been in New York Times, McKnight. He would just give us a briefing every morning, and he'd highlight ones like this, read this before you speak to anyone. And so this is his passion and his hobby, and I'm hoping his hobby sticks, and then he just keeps sending me those emails because I'm not sure what I'm going to do if I don't get them in the mornings. Thank you, and thanks, Dan Beam, for making sure that we had that covered today. The next presenter is not able to be here, but is a huge advocate not only here in Connecticut, but across the country related to Medicare. So Judy Stein is an individual that's been advocating on behalf of long-term care residents and their access to Medicare in the nursing home when they are back in their, if they go back to their home. And what we're hearing is that there's been more challenges related to individuals having access to their Medicare and with the policies where you maybe have an advantage plan and people's coverage stopping very quickly and then having to file an appeal. So we're really asking that when you go back to your resident councils, that you have an opportunity to speak with your peers, especially the short-term residents, and explain that if they have a Medicare Advantage plan or a traditional Medicare plan, and they feel that they're being told that their benefits are ending, sometimes you hear you're being discharged from Medicare, right? And people get very nervous that they're being discharged, not necessarily from the nursing home, but from Medicare. And so when that happens, they become alarmed. We have seen an incredible increase in the number of calls and complaints we've had related to this, where they don't feel they're ready to go home, they don't feel it's safe. And so we're working with individuals to connect them to the Center for Medicare Advocacy. In your packet is a page. You can make copies of this. You can share it with your long-term care community and ask them to post it, as well as get information out to family members. It is really important. People should be experiencing the same coverage, whether they're on an Advantage plan or traditional Medicare, and we're not seeing that happen. We also need to use our voice to talk to our elected officials at a national level to ensure that people have appropriate access. As we've seen more state employees retire, we all have the Advantage plan. It's really important that we're messaging back the impact that that's having. So Judy just wanted me to make sure that you guys had this information. You're still welcome to call our program, but one of the things we're going to say is, have you filed an appeal? Right? Have you filed an appeal and explained why you feel you're not ready? And 2, if you lose your first level of appeal, you have a right to do a second appeal. But you can also reach out to the Center for Medicare Advocacy. They have attorneys available that will work with you and encourage you to follow up. They'll offer you support just so that we ensure that you get the most out of your coverage. Okay? Wonderful. This is like the first time ever and a lot of you have been here many years, we've never been ahead of time before, but people got in and seated so quickly. I don't really know how that happened, but we are. And now I would like to introduce John Beliciano, who's one of our e-board members. When I say e-board, I'm talking about the statewide coalition of presidents of resident council. And you'll see in your packet the names of them, their phone numbers, and an email address. And I was a little bit like, oh, we're putting all that in there, but that's what they wanted. They want you all to reach out to them with questions or concerns. Regionally, they're there to support you, and they're going to, bring it on up, Dan, they're going to work with you. We'd also like to see more residents on our e-board, so if you're interested, please reach out and let me know. And John's here today to talk to you about your resident council meetings. We're going to set up a little spot for him. Thank you. I have to tell you, I am so proud of these guys. They meet with us twice a month, at least, and really use their voice to help me shape my legislative agenda, to bring issues and concerns to me. I run by them what I present to the other state agencies as well as to the legislature. So these guys are incredible in the way that they use their voice. And John did this presentation on his own. I'm worried about it.
Okay, I'm here to talk about resident councils and how important they are to nursing home facilities. So the way I'm going to present this is let's figure out how we're going to set up a resident council in a facility. And these are the basic things that you need to set up a resident council. But first, we need to find out what a resident council is. And a resident council is an independent, organized group of people living in a long-term care facility that meets on a regular basis to discuss concerns and develop suggestions to improve services or resolve differences within the facility. So that's pretty simple, but there's still some more requirements that you need to go through. So next, we need to determine what rights a resident council has within a long-term facility. Next slide. So here are some of the things some rights that resident councils have within a facility. The facility must provide a resident council with a private space for meetings, whether it's in a dining room or in a other type of room that you can meet. The facility must take reasonable steps with the approval of the resident council to make residents aware of upcoming meetings in a timely manner, which you could do like either you can make a flyer, give them out to the residents, say this is when we're going to meet. I invite you to come to the meeting so we can hear your voice on different issues and concerns that we have. The resident council meetings are closed to staff, visitors, and other guests. For staff, visitors, and other guests to attend, the resident council must invite them. Now, this is probably I don't know if it's a problem in any other facilities or not, but it's usually the president of the council invites those people to come to the meeting. Like this past meeting that I had, I invited the new administrator to the meeting, and she came and she introduced herself and other like that. And what her plans were and everything. Next, the facility must provide a designated staff person who is approved by the resident council and the facility to provide assistance and respond to written requests from the resident council. Usually that designated staff member is the recreation director or any other person that can deal with the resident council. The facility must consider the views of a resident council and act promptly upon grievances and recommendations of the resident council concerning issues of resident care and life in the facility. Let's take an example like staffing. They can bring their concerns about the staffing to the resident council meeting, and we can discuss the effects, and give solutions, and we can bring that to the administrator. The facility must be able to demonstrate their response and rationale for their response. And I believe there's a form that you can fill out for that. I think that's in your binders as well. Once we find out the rights a council has, next you need to look at what's the purpose of a resident council meeting. Why do you have a resident council meeting? Well, one is to give residents participation in affairs within the facility. Next, it's to give residents a forum for discussion of concerns within the facility. Next, it's to serve as a line of communication between residents and staff. Next, it's to serve as an informal forum. Next, it's to empower residents to advocate on issues that affect their home, community, quality of care, and life. And it's much like the care planning meeting. You can, because that's important. It's also to discuss concerns, to determine patterns, and allow for formal resolution. It ensures that nursing home is working to residents' best interest and creating home-like environment based on resident preferences. And those preferences could be either health issues, or, whatever. Okay. Next, we need to find out what are the benefits for the residents versus the home. To the residents, it's a resident council is an organized and ongoing support mechanism for residents. Through shared experience, residents are able to draw strength from one another. Next, residents feel comfortable discussing their concerns and/or wishes in a safe environment. And then the resident councils also provide an opportunity for residents' interaction and engagement with their peers. I look at this as we're family at a facility, and we need to take care of our family there. So whatever their concerns are, well, I think we need to take care of that because they are part of our family. And to the home, resident councils allow for greater communication between residents and staff. Resident councils provide discussion opportunities for a collaboration between residents and staff. It's also a mechanism to address concerns to improve the quality of life and care in a facility. And it's also a way to know the staff there too, and what they need to do. Okay, a resident council needs a basic setup to run smoothly. So this is what a model resident council should look like. Residents run the council. Residents fill key positions such as president, vice president, treasurer, and secretary. In my facility, we don't have a treasurer. We actually don't have a vice president or secretary. So I'm like all those rolled into one. The council receives no interference from the facility staff. Residents feel comfortable speaking freely, raising issues and concerns. Residents are treated in a dignified manner. Residents' issues and concerns are taken seriously. Issues and concerns are promptly addressed by the appropriate department. And the best way to do that is to try and get it resolved after a meeting is held or in a reasonable time frame afterwards. So, what do we need? So we also need to find out what are the best practices that a resident council has. Resident council meetings are marketed and advertised and considered invitations. Like I said, you can make a little card invitation that says where the meeting is being held. You're invited to voice your concerns or issues, and because that's more on a personal level, because some people don't even know we have a resident council. Next, the council meeting. Council meetings are consistent, same day, time, and location each month. We have ours on a Wednesday every month, once a month. Each meeting has a prepared agenda with input from the council members. A council is governed by bylaws that are unique to the home community. Bylaws detail election process. Now, this is a very important thing to remember. Minutes are taken, reviewed, and approved by the council members. Council communication form is utilized, passed on to the appropriate departments, resolutions indicated, signed off by both administration and resident council. Meetings are accessible to all residents wishing to participate. Use of adaptive technology and recording meetings for those that cannot come in person. This is also an important thing. Resident council and food committees are separate and distinct meetings. In other words, we have our food committee meeting first, and then we go into our resident council meeting. And you know that you have, if you are doing well, you achieved these 3 goals. Self-interest, encourage those who have concerns to address them during the resident council meetings. Residents will want to be involved if the council is discussing an issue that is important to them. It may be helpful to identify the issues of interest for the council members and focus on those issues. Results. Getting results is a big motivator for residents to continue to attend the council meetings. Thus, the council is viewed as a forum for resolving concerns, implementing new ideas, and sharing suggestions. And recognition. Recognize council members who provide helpful solutions or make important contributions to the council. So these are some of the things that you can do to either start up a council or even to improve your resident council. Thank you.
Okay, so we have a couple of minutes. I was wondering, John said he will take some questions. If residents have questions about their resident councils, they can. I see Sylvia in the back has a microphone. Tasha has a microphone, and Lindsay. So if you raise your hand, if you have any questions about the presentation, I also want to give you a huge round of applause. A few years ago, when John first joined the e-board, he did not like speaking in public, and he wasn't comfortable all the time we went places, and you have made amazing gains, and I'm so impressed. Every time you come, I put something out, I'm like, I need somebody to join this board or do this. John's like, I got it. So super impressed. Thank you. All right, do we have any questions? All right, I see one out there. Here, I'm going to give this to you. And is there another handheld beam?
Yes, my name is Frank Finderak. I'd like to know what are you going to do about your staffing problems in our facilities?
Should I answer that?
What about our staffing problem?
can have that answer with you. Okay, so I heard a staffing question. We are, oh, here you go. We are going to have a panel after lunch that is going to have individuals who are from our state agencies. We're going to have another member of our e-board, and we will talk about staffing. But I think you can talk about, John, how, if a staffing concern came up during resident council, sorry, I didn't mean to put that in your face.
Oh, okay.
If it came up during resident council meeting as a concern, what would you do with that kind of concern if it's brought up by residents?
Okay, the basic thing that I would do as a resident council president, and if that issue was brought up, I would first bring it up to the administrator and see, what are you doing for the staffing issue for this facility? Are there any things in place to rectify this problem? And if so, what are they? What are they, and are they really solving that problem? Because right now, we're still having staffing issues.
That is a great point. So using your voices together, and then you would file it formally with the administration and get something back in writing about how they're going to address that.
Yes.
Where would you put that? So I think this is important because we have DPH is here, and when DPH goes into the building, what do they look at? Will you get that back from the administrator so that everybody knows? You file something, you get it back from the administrator in writing, then what do you do with it?
Well, put it in the binder.
Yes. He just looked at me like that was the most obvious answer, and why was I asking that? So yes, putting it in your binder. And so you can use the binders we gave you. Resident council should have a binder so that when you're filing something with administration, right, once you get it back,
Yep.
you want to keep that all in one place so that when the survey team comes in and they'll say, what were the issues and the concerns? Where's your binder? And you got it all there.
And also on that note, you should also have a copy of your minutes that you take. Like the recreation director has it, but also the resident council president should have a copy. That way, if somebody comes in, if the recreation director isn't there, the resident council president has the copy too. So we can work hand in hand like that.
Very good. Is it Sylvia?
Yes.
Good question.
Over here. Want me to hold it?
I'm still trying to figure out how to get more people to get involved in the coming to the resident council meetings. I'm having problems with that, and I tried different things, but it's not working.
What do you suggest, John?
Well, I would try and do the personal effect, like inviting them through.
They know me. All of them know me there. I ask them all the time to come.
Yeah. Well, did you try inviting them through a flyer or something like that?
Invitation?
Yeah.
I can try that, yeah. I can try that.
Because I think sometimes they need that personal touch from somebody. And they know that someone does care about them. And they want to hear they want to hear from them. They want to hear their voice. So I think either an invitation or a flyer you should make up and say, this is the time of our meeting, the date, the time, or whatever. And
I can try
hand
that.
hand it to them, or have
Myself,
somebody.
right.
Okay.
Right. I'll do that.
John, how soon before the meeting do you remind people? Like, I know you give the flyer. Do you ever give, like, the day of or a day before, just a little cue to, like, hey, make sure you come?
Probably the week before.
Okay.
The week before the meeting is going to be held. Or you can, a week before, you can give it to them.
All right, we have a question over here. Go ahead.
I can make it up.
Hey, my name's Kevin Sullivan.
I can make it up.
I just have a very interesting.
Go ahead, Kevin.
Okay, I have a very sensitive question
Okay.
regarding when a resident comes to me with a complaint about the administration and they're having ongoing legal battles with the administration. Do I just refer them to an ombudsman?
Yes, I believe so.
I mean, can't think of
Your
anything else
local
to do, 'cause I don't wanna get
ombudsman would
involved in
probably be the best person for that. Because you really do either that or first go to your recreation director and ask him or her what to do. And then I would go to your local ombudsman, and they will let you know what route to take from there.
Absolutely. You can always call, we call them ROs, you can always call the RO, your regional ombudsman, and they can assist you. The one important thing I'd say, just make sure, as long as the person wants, we've had some questions recently about documentation in the minutes because people want to be anonymous sometimes when there's a question or a concern they're bringing up to the group. Ask them if they want to be identified in the minutes. But if there's a concern about something that's someone that's going to get the information, like administration, you can always, the regional ombudsman can help coach you through that and support you as the president to make sure that you feel comfortable and the individual feels comfortable. Sure. I see two questions. One there.
I have one here.
Tasha's come.
I have one right here.
Oh, okay. Sylvia?
Hi, I'm Julie, and this was said in regard to the Resident Council meeting. We found it really effective at our facility to have half sheets of printed paper saying, please attend your welcome, or two, and Resident Council meeting will be at 2:00 in the third floor dining room the day of the meeting. Because people with memory difficulties forget, and with it right in front, it's increased the attendance dramatically.
Wonderful. Thank you for that. Okay. Tasha has someone. Okay.
Oh, I think my question comes back a little bit about the first question that was asked about shortage of personnel. I'm fairly new now about the resident councils, but my question is you present your question to the administration about the shortage of personnel, enough personnel. How long do you wait? And what do you do, like we are seeing right now, that the issue is not as easy to resolve as we used to think in the past, or as it was used to be done in the past to be resolved? What would you do?
Once you fill out the concern form and give it to whoever is in needs of that, I think a reasonable. Now, you should get results back, like by your next meeting. But if not, you should get something back saying, we're still in the process of resolving this.
And we've been doing this for over 2 years now. So we also use agencies, and I'm not saying just my organization, but I mean the system. It's been over this problem for over 2 years. What are we thinking that we need to come up with some new ideas, some new advice, some new concerns about this issue, because we're going to continue needing the personnel, the correct personnel, the adequate personnel, or the system is going to disappear if we don't have enough people to treat our residents the way they are expected to be treated. Are we thinking, are we creating any new committees, which is one of the things that I think it should be done? Are we suggesting new thoughts that has not been proven before, since like now we have so much new new developments in communication? Aren't we going beyond what we have normally been thought the issue should be, like, let's put an ad and then maybe we can advertise like Walmart does, we're going to increase the salary that many dollars. We need to be a little bit more intensified in the to the solution of the problem, and going to different levels: educational, political, governmental, and regional.
I agree with you.
Thank
I
you.
think that's going to be I want to make sure, Tasha, this is on you. We're coming back when the panel's up to ask that question. But I think John's answer is a great tool for you all to say, yes, get it in your resident council minutes. It's also what we've heard from survey teams, is it's really important for you all to be as specific as possible. The most challenging time is 3 to 11 on Saturday and Sunday. And March was worse than February. So that way it allows the team to see what did the administration do to address that? Did they try other things? Did they put different mechanisms in place? But capturing that in the minutes as detailed as possible is really helpful. Okay. Yes, ma'am. Miss Patty.
Hi, John. First of
Hello.
all, that was a great presentation.
Thank you.
And my question to you is, your facility, do they offer any incentives to the CNAs other than wages?
I was told they do, but still, still people are leaving. We're not getting new staff in. It's really tough. I think I brought an issue out to Dan this past week that we were short on Monday, and we just had to deal with it. We had like one CNA to do 35 people on my side. But then we had a couple staff members to join in later on. So, because people are quitting on us, they're leaving. So, now I don't know why we're not using agencies or not, or our company don't believe in using them, but I think we should as a temporary fix. So, but I think what I need to do is maybe write a letter to the Apple Corporation and see, what are you doing to address this issue? It's getting worse and worse.
Letter writing, that is something Anna talked to you about, right? Is that something that Anna worked with you guys on? How to write a letter, your problem statement, offer solution, get feedback?
No, but that's what I would do. But that's what I was thinking of doing.
Okay.
John, I think we all need to set up a march to the owners of our facilities and demand answers.
Yes, I think we should.
Set up a conga line and let's go.
Okay, Patty. Now you're going to give me heart palpitations because just getting everybody here. Now you guys want to march. This is the e-board I have. They come up with some amazing. You guys are amazing, but some of the ideas give to Washington. We might want to start with Hartford before we go to Washington, because I think it's a great idea. I would love to see that happen. I'd have to mull that around a little bit, figure that out. Yes, Lindsay.
Thank you for this opportunity. My name is Wadia Colwell, and my question is this. I know the state requires activities during the day, and my question is, why is it that like my facility does not allot a certain amount of money towards doing activities? Because the residents are really, really bored with the activities, and we don't have simple items like paint or arts or stuff like that, and they're wondering why aren't we allotted funds for that? And the other question is, it's regarding food. Maybe this will be addressed later on. Is we're constantly being served eggs. I don't know about anybody else, but eggs every single day, 365 days a year. And the residents are asking for other proteins to substitute the eggs at times. And we're not getting that. So is there a way to let the administrator know? Because we've spoken, they've been to the meetings, we've spoken, and nothing is happening.
Is this an issue that you brought up at our resident council meeting?
Yes, that's an issue, and we've even had the appropriate committees come in there and hear about the issues, the food, the kitchen personnel, etc. And yet the food quality is it's the worst.
Well, I know each facility is different as far as food goes. I don't know, because we get like grade something and some people get, so I don't know how big your facility is. So.
And I would document that, right? If you've gone to administration, you've had them at the meeting, what was their response when you guys said, like, eggs are great, but we'd also appreciate whatever else you've asked for, and then have them respond in writing as to how those changes are going to be made, what they're going to do, how they're going to address that.
Okay.
And I would ask for it, we're going to be meeting again on such and such date. We'd like to review your response. Can you have it to me by maybe the week before your meeting so you guys can discuss it? Okay. And then keep that. And if you're not seeing that it's happening, you bring it up the next month and you go over like your past business, what you guys brought forward. And then when you're in your new business, what are you asking this time from the administration?
The art, thank you for that answer. As far as the recreational stuff, is every facility different as far as providing funds for the activities? How are we expected to do activities if we have no funds?
Do you have say in your building of it? Do you go over what programs you guys are looking for? And
Well, we usually go over the like we have a monthly calendar that we go over monthly at our meetings. Like if we had a meeting today, it would be for next month, and we would go over the activities for the following month. Like next month, I'm planning on doing something for Residents' Rights Month,
which is October. Yay!
Yay.
And so you can do something like that, something that really don't need the funds, like you're saying. But I know you need other activities too, but Like what activities do you want? You want more variety of activities?
Oh, the residents are asking for art activities like painting and drawing and things like that that they could physically do. And you know, we don't have the resources to do that.
I would strongly suggest bringing that up in resident council, asking for an opportunity to meet with the rec director and to have say in your calendar, right? The recreation program should meet the individual desires of the individuals that are there, right? So you guys should have the ability to say, these are the programs we're looking for. The makeup of the building might be different, right? You may have had a shift in the population and who's living there and what they want to see as far as programming. And so you should have a say in that, and you guys can make a list of what those things are. And then the administration should be supporting that. Now, if you asked for a lobster dinner every night, they may not be able to do that. But it is reasonable to assume you would be able to have art supplies for people to be able to go in independently and use, or to have programs around. That to me sounds very reasonable. So just capturing that in your notes, what was their response, and that there's a timely response to that would be what our expectation would be.
And Maraith, I just want to make a plug for the binder again. The first section has John's PowerPoint in there, and it also has a wealth of resident council resources, including sample bylaws, sample agendas, and a communication form that resident council can use to pass from one department when there are issues brought up. So you can send that off to the department, expect a response, have it signed, dated, what the response is, and it goes back to the resident council for your review. So that is in there too. Just want to make sure you're all aware of that.
Thank you. Okay, we have one more question, and then I'm gonna talk about, two more questions, sorry. Two more questions. Okay, Tosh.
Yeah, my question now has something to do that now that we are being very concerned, politically speaking, about the environment and what's going on with the environment and how we are going to be solving some problems. I realize, and I know because I'm one of those, that is a vegetarian. And like everybody else, I don't like to eat the same, let's say, spaghetti with tomato sauce for lunch today, for dinner tonight, and for lunch tomorrow, and more or less the same thing over the weekend, and the same next week, which is the same things going over and over. My concern is that I don't see that much attention is being paid to this subject when I see that the number of people that are turning into, and that will be turning to, being vegetarians, or that will actually not eat any meat, or will only eat fish meat. Are we really thinking beyond the level of the organization that one is living at, but from the government and from organizations like this one, about what do we want to do about that? Do we want to, no matter what, have some requirements like we have for medical issues, certain medical issues, certain behavioral issues? Are we going to be working into making sure that we start incorporating some of these issues, so when we have residents that apply to these places, they disclose what their condition is regarding food, and the administration knows that you have one resident or you have 5, that it is not something that comes as a surprise and that nobody that works in the kitchen knows anything about that. Or that, like I said, will come back with those repeated menus. Or go to the store, like I have heard, and buy for this week 1 avocado and then maybe 1 veggie burger. And then when that's over, next week, so I have to start repeating the same things as before again.
I think that's a really good point. And we do have people with very varied palates and want to have different things, right? And they should have those options available.
Well, I think that should go to dietary.
Mhm.
If the dietary can't help you, then first of all, it should be in your care plan.
In your care plan, he said, go to dietary, and you have a food committee, you said.
Yeah, food committee.
And what do you talk about at food committee?
How's the food?
Are they giving you things you like and
Oh, yeah.
the menus?
Yep, and suggestions for
would-
change.
Yep, I would bring it up at food committee and then get it in writing what they're going to do to address.
What happens when I bring the subject in a meeting. It just goes beyond that. It just goes beyond what are we going to be doing to ensure that now that the environment is changing, like we say, it has changed, and then we see that it's changing, we're going to have a lot of more people that are going to be getting to other ways of eating. And
they should be meeting that need. So that should be something that the nursing home's able to meet for the people that live there and want it.
Exactly, that should be available. There should be something that is
just
not a
pasta.
surprise, and you have to wait a year to find out, are you going to do anything extra?
Yeah, no, and you can also, so I would address it through food committee and things like that, and the regional ombudsman can help you. And when DPH comes in for survey, that would definitely be something I would want to talk with them about. All right, we have one more question over here, and then, yes. It's about, yes.
I live in a Genesis facility.
Mm-hmm.
If you live in a Genesis facility, you can go eat anywhere and you're eating the same thing. It's one corporate menu that rotates every 3 weeks. Every month, I have complaints about the food. Every month, we write them down. This month, I got a request to be invited to Resident Council and Food Committee. It's the person from corporate, the regional. He wants to hear with his own ears everything that we complain about. And then, I guess he's gonna take suggestions, and unfortunately that hasn't happened yet. I think it's next week.
We would love to hear the outcome of that. Who's your RO?
Brenda Texador.
Brenda T. So Brenda T, when you have the outcome, because I think that's proactive, right? They're coming, they're meeting with you, we want to see what the outcome is. If you could let Brenda T know. We have something, I hope you all know, we have a Silver Panther, which is a newsletter that goes out seasonally. With the best intentions, it goes out seasonally. And so we'd like to put best practices in there. So if something's going on in your home or with your resident council that's working and great, that you get it to us so we can put it in there. Okay, it is 5 of 12. I am going to talk about one more quick thing, give people an opportunity to use the ladies' room. We have a men's room or behind in the next room over. And you can, Andre, can you raise your hand? If anyone needs assistance figuring out where to go, you can ask Andre or any of the team members. In your packet, you also have something with some little circles on the top of it. And I see, Rick, can you raise your hand in the back from our family council? We have one of the country's first statewide family councils. I want to encourage all of you to encourage your family members to start a family council that is separate than the resident council, but you guys can work in coordination to have issues and concerns brought forward and addressed. One of the things we've learned over the past few years is that virtually we can do things. So the Ombudsman program has paid for a large Zoom license, and a family council can tell us the date of the month they want to meet, for which buildings, and we will give them their own little link, and they can meet virtually. And then they can also be a part of the statewide family council where they'll get resources and monthly updates and help them with the planning of the meeting so it doesn't feel like it's all on them. And then we're using our statewide family council also to advocate at a national level, and we have some really strong people. They've been working on the national bill related to essential caregivers, and I've been so impressed by them. So if you don't have a family council in your building, residents, please encourage your family members, and both associations are here today. Matt and Mag are here, and they were wonderful in helping us push information out to the nursing homes about their responsibility to help you start a family council. So the buildings have that. There's information on our website, so please do that. And now we are going to have lunch, and then at 1 o'clock we'll start our open forum with the larger panel. Thank you. That was awesome. You are amazing. I'm super impressed. You were talking about what's happening in your homes and ideas and supporting each other. So I want to thank everybody for, oh gosh, that was quick. Everybody came back together. I want to invite up our panelists now to come join me on stage to take questions from you all from open mic. So you guys, Kim's in the back, Patty. What I'm going to do is we can move these up. Here, maybe I can. Move this over, maybe, right? Let you guys be on one side. You're too far back. Come to the front. We'll go. You guys can be up front.
You want us to move the chairs?
Yeah, to one side so I can. I'll move this over so that you guys can sit up front. Okay. And then we need room for Patty's going to come up and join us, Patty. We may not need all the chairs.
Oh yeah,
Pick
well,
your
should
seat.
we create space on the end for?
Yep, we're gonna have her.
Let's move this one. Can we pull one of the chairs back?
Spread these out a little bit. I'm gonna sit. Can you give me one more handheld, please?
Just for. Hey Patty, hello. How are you? Good afternoon.
Patty's one of our members. Yes, ma'am.
Yes, that would be.
This is everyone's favorite part of the day. I know residents often wait for. You good, Sylv?
Yes, thank you.
Yes, thank you. Here, I'm going to push this one over so I don't trip myself. Are you on the safety committee in your building? I said, are you on the safety committee in your building helping out, spotting stuff? You might as well. You could always help out, right? All right, so this is normally individuals' favorite part of the day because they get to ask questions of everyone, all of these awesome professionals who have so warmly accepted our invitation to be here today. I'm going to ask them to each introduce themselves and say a little bit about their background and why they're here so that you know who you're asking questions of and that you can get the answers that you've wanted. So, Guy.
Great. Hi, everyone. I'm Guy Woolston. I'm Connecticut's Medicaid Director. I've been in the role, I'm new, I've been in the role for 5 months. Just 3 sentences on Medicaid. So 70% of residents in Connecticut's nursing home have their stay paid for by Medicaid. So we're the people paying for the care. And I'm very much a believer that the incentives that we set for the homes can impact the care that you receive. And I'm really honored to get questions from you all and to hear about your concerns so that as we're thinking about setting the payment, we can do that in a way that respects your preferences, your voice, and your needs. So thank you so much and looking forward to getting your questions.
Good afternoon. I'm Kate McAvoy, and I'm currently serving as a program officer for a healthcare foundation in New York City called the Milbank Memorial Fund. I have had the privilege previous to that of working for about 30 years with many of you in the room on long-term services and supports, and I do want to just congratulate you. This is just an extraordinary event. You set the standard for the entire country in bringing your voices to shaping policy, so we'll really look forward to hearing from you.
Good afternoon. I'm Nicole Godburn. I'm the fiscal manager of the Reimbursement and Certificate of Need Unit with the State Medicaid Program, the Department of Social Services. Our office is the office that works under Guy, and we work very closely on setting the reimbursement methodologies and the reimbursement paid through Medicaid to nursing homes. So just want to echo Guy and his comments that we really very much look forward to working with you and hearing your thoughts and concerns, because as we know, Medicaid is the primary payer for most nursing homes. So just really getting that feedback from you as we look forward and look towards quality incentives being paid in the Medicaid program.
Good afternoon, everyone. It's great to see everyone in person. My name is Kim Rizniak. I'm the Public Health Services Manager at the Department of Public Health. I've been with the department for 18 years, and the majority of my career, which I'm not going to tell you how many years that is in nursing, has been in the long-term care industry. So what I do at the Department of Public Health, you have the surveyors that come in to see you annually or a little bit more frequently if there's some complaints. That's my department. So the surveyors are underneath me. And I know there was a lot of questions in regards to resident council and some follow-up questions I'm sure will be forthcoming. So I look forward to answering those for you.
Oh, I good. Thank you. Good afternoon, everyone. My name is Patty Balsh. I'm a resident in a facility in Newtown, Connecticut. And what brought me to the facility was I had a stroke in 2011. I've been there for approximately 4 years now. I am a very strong advocate for the residents there. And I believe that together we can do anything, all of us. But we need to work together. Because as I mentioned earlier to John, that we need a march. But, okay, I know most of us can't do that, but wheelchairs are powerful. Our voices are powerful. And I feel like those of us on the resident council, some of us are the voice of the voiceless. So we have a lot of work to do, and I think the way to get it done is to be heard. And I've been through a lot in the 4 years that I've been in my facility. I've seen a lot with COVID, some good, some not good. And I've lived through the staffing situation with the pandemic, and that's still not good. So there's been a lot of pluses and minuses. But the staffing You know, every time you get a little inch, it seems to get yards and feet more, because it's not changing really well. You know, this reform, that reform is still not enough.
Thank you, Patty.
Thank you, everybody.
Thank you so much. So our first question was recorded because we did have some members of our e-board that weren't able to attend because they didn't have staff to accompany them. So Jeanette, who's been on the e-board and is now emeritus status, wanted to ask a question. So Dan, if you could. Hmm?
My name is Jeanette Sullivan Martinez, and I was an executive president for the executive board, for the last 7 years. I'm now at emeritus status. I reside in a nursing home down in Mystic. I have some grave concerns. I want to know, where are our staffing levels? They're supposed to be at 3.0. Pre-pandemic, we had difficulty with staffing, but now post-pandemic, it is worse than it's ever been. So if you could help me find out what's happening with staffing and how we can improve that and make it better for our residents living in our nursing homes, I would greatly appreciate it. My day-to-day has been gravely changed post-pandemic. I'm not with you today due to the fact that we don't have enough staff to be able to accompany me and meet the needs that I have. I am total care, like many of you that live in a nursing home, so we depend on our nursing staff to help us get dressed, toilet us, even feed us at times. We have many, many different needs, and unfortunately, we don't have the staff to meet those needs. I implore you to please work on this, speak to your legislators, help us to get this problem that's not just a statewide problem, but it is a countrywide problem, worldwide problem that needs to be addressed. You could have one person working in this building or 50 people working in the building, and what happens is my care doesn't change. What I need day to day is the same, whether you have enough staff or not. Unfortunately, it means waiting longer. I've had to wait over 25 minutes for a bedpan, 30 minutes to get into the bathroom, with almost having accidents, which is degrading and demoralizing and should never happen. So please help us change our staffing.
So I thanked Jeanette for being so vulnerable in that and bringing up so many points. And we know that this is a challenge. We heard earlier today how much this is a challenge. So I didn't know if each of you wanted to take an opportunity to talk about staffing from each department or area of expertise and what's currently happening and what we're hoping to see moving forward.
I'm going to start off. So I have a couple comments based on some of the questions that were asked earlier. I just wanted to make sure that you're all aware that we work collaboratively with the Ombudsman's office. So any of the concerns and frequent concerns that come up to our department, you know that you could always submit a complaint to our department. However, but if there's a grave concern, May Reed and her team always reach out to us, and we try to rectify it before anything kind of implodes. So we're readily available and working collaboratively with her group. The staffing, there was a public act, I believe it's 21, and correct me if I'm wrong, 185, that talked about the staffing 3.0. As far as our department goes, we're in the final stages of, we wanted to make sure that the numbers worked out. We're working those out, so there's distribution for the nurses and the nurses' aides to meet the 3.0 staffing needs. And then we need to provide education to everybody, right? To make sure that everyone knows that this is what the expectation is, and this is what we're going to be looking for the staffing moving forward in all of your facilities. Staffing has been a challenge through the pandemic for whatever reason. There's a lot of individuals that are leaving healthcare, so I think we're seeing the outcome of that. However, that's your home. You still need to have your needs met. Again, if there's significant staffing issues, May Reed is, I think I have her on speed dial and vice versa. We have frequent conversations about that, and many times what we will do, with your permission, of course, if you have a complaint in regards to staffing and can give us specifics, we reach out to the facilities and we ask them, please send me your staffing. I want to look at it. I want to see who's there. And if need be, we will send somebody to go and to check on the staffing, whether it be one of my staff from the Department of Public Health, or it might be somebody from May Reed's team, just to verify what they're showing us on paper is actually who is in the building. And if we need to, we will open an investigation and talk to your facility staff about that. That's how we are addressing the staffing issues currently through our department.
There you go.
Great. Awesome. All right, you can hear me. I just want to compliment expand on the response. Previous response focused on the regulatory side. I want to focus on the financial side. So, as I mentioned before, Medicaid pays for the majority of resident days here in Connecticut. One thing that I'm really excited about is in 2021, the legislature passed a law enabling for the first time Medicaid in Connecticut to pay nursing homes based on quality. So nursing homes, and that will come into effect of July of next year. If you think about it from the nursing homes standpoint for a moment, we want to give them incentives to hire and staff the homes in ways that are going to be good for resident health and also resident satisfaction. And I don't think that single policy lever alone is a cure-all, a panacea, but I do think it's an important piece of the puzzle to give nursing homes that financial incentives to deliver high-quality, patient-centered home, of which staffing is a really important part. I do also want to recognize, as the questioner mentioned, this is a nationwide problem. It's partly a problem of supply of caregivers, and that's something that's harder for any individual home to solve on its own. But I do hope that the financial incentives that we're going to give starting in July of next year will help. And I know July is too far away, but I just wanted to let you know that is coming, and I think that is going to be a really important policy lever that we have.
And then just to echo on top of Guy's comments, the legislature and through the public health emergency has done quite a bit in getting money into the Medicaid reimbursement to help support staffing. For example, there's a 4.5% rate increase that went into the Medicaid rate, and that money is specifically designed to go to the staff who work in your homes and to make sure that those staff are rewarded for the hard work that they're doing and to try to incentivize more folks to come into your buildings and work in your homes. So there have been components along the way throughout the pandemic through the Medicaid reimbursements where the legislature has recognized the hard work that your caregivers are giving to you and tried to recognize that through rate increases. But to Guy's point, when we go to the quality component under the Medicaid reimbursement that will take place in July of next year, we really are seeking your feedback regarding that, of what are the pieces of quality that in particular you are looking for, what do you want out of your homes, and how can the Medicaid rate support that. So we will, of course, be engaged with you and seeking some feedback from you. And then also, too, as a reminder, in July of this year, the Medicaid reimbursement flipped to an acuity system. And acuity reimbursement systems are designed to increase the reimbursement based off the need of the resident. So if you need a higher level of care, the reimbursement is supposed to increase to help give that extra support to you. So that was another thing that the Medicaid program did to try to give more staff supports in your buildings.
I really appreciate all these thoughtful comments from colleagues on the panel, and I just want to reinvoke what Mairead said at the outset. This is really about very specific and immediate and intimate needs of all of you in this room and many other folks who reside in nursing homes across the state and the country. We know from the research that the single most influential factor in whether people get good quality support in a nursing home is adequate nursing and nursing support. That's just absolutely clear that that is the essential feature. So if we say right now you are experiencing that there are not sufficient nursing staff, there are not sufficient aides, I'm hearing that from folks across the country. This is, as Guy said, not isolated, it's not regional, it's a countrywide challenge that everyone is grappling with. Guy and Nicole in particular talked about ways in which the publicly financed healthcare can try to influence private sector businesses in providing more of that type of high quality care. I also want to say there are other features though. I think we know that money is one of the pieces that is going to be instrumental, but I think a lot of folks are talking nationally about the need to address other aspects of the employment benefits for people who work in nursing homes, their healthcare coverage, their fringe benefits around leave, their life and work culture experience. For instance, many folks, as you know, are asked regularly to work overtime or work double shifts, things that are just challenging because of those staffing shortages. So looking at those other benefits and aspects of workplace for people, also looking at how we can inspire additional folks to pursue this as a meaningful career. And that's something I was talking to both Mag Morelli and Matt Barrett about just a few minutes ago, thinking about how to inspire people at a much earlier age, as they're coming up through high school, to want to pursue this, because frankly, what the evidence also shows is that the staffing crisis is more acute for nursing homes than it is in any other sector of healthcare. It's more severe than it is for hospitals or for home care or for other aspects of healthcare. So we need immediate attention to bringing more people into the field, treating them with respect and support in the same way that we want that for residents, and making it more economically secure position to do. So just know many folks across the country who are resident advocates, such as yourselves, are raising their voices. I think this is an essential companion to saying, using these facts around the shortages and also how critical the staffing is to your care. And I would urge you continue pulling those pieces together and using your platform to carry that message.
Thank you. All right, if you have a question you would like to direct to the panel to ask yourself, please raise your hand, or if you have written it down and want someone to read it for you, an RO will come greet you. I see one over there, guys. I don't know if you have somebody on that side. Brenda's gonna. Hey, they're gonna bring you a microphone, sir. That way we can all hear you.
Yeah, I just have a quick observation on the staffing shortages and all that. A lot of it's due to COVID and just the prolongment of how long they've been under the circumstances, and I'm sure they're getting kind of tired of it. And they've been compensated only $1,000 that I see, and I'm not sure what else they've been compensated. But what adds to it is the fact that across the whole nation, supposedly they wanted to get a $15 wage increase, which is fine until the economy started to fall apart and inflation took over. that could be a big cause of why you're seeing a lot of people turning away from work, period.
Thank you. Those are very meaningful comments, and we agree. COVID had a tremendous impact on caregivers who showed up every day and are tired. They've worked tirelessly this whole time, so thank you.
Okay, I'm going to speak as a resident advocate about some residents that I'm representing that when they arrive in the nursing home, meeting level of care and an MFP referral is made, there's an active work on eventually preparing for a discharge, finding a community placement. However, at some point, these residents no longer need to be in the nursing home and are denied continued stay based on, the ascend process, PASAR. MFP drops them. So I have one resident in particular who was very active with MFP, was active going out into the community, finding placement, really excited about that, but then was denied continued stay, and MFP dropped him. So there is no help whatsoever to really find a community placement. That's just one example. There are others that I could raise. But it's very concerning that MFP operates that way, and I wonder if there's any resolution or any kind of solution to that type of problem.
Thanks. First of all, thanks for that. And I might connect with you one-on-one after to better understand the particular circumstances, although I realize you're talking about a general trend, not just the particular circumstances. So one thing that I'll say is it is tricky. The Medicaid program offers more support for people depending on the level of care that they need. And I think, honestly, for good reasons. We want to make sure that the dollars flow to people who need nursing home level of care, who need it, and in an environment where resources are not unlimited, we want to make sure that our most needy members get the care that they need. I do think, and I'm new in my role, and I have a lot to learn. I do think there are opportunities to make the program have a smoother transition, both as people are in facilities and at home, but also as folks are kind of on the boundary of needing nursing home level of care. And I would love to hear more about the experience of the residents with whom you're working, and think more about that topic. And Kate, I know my predecessor for a decade, I'm sure has a lot to add, so maybe I'll hand it over to you and would love your thoughts as well, Kate.
Yeah, I really appreciate you raising this. And this is, the great thing about talking frankly among ourselves about how things work in practice. What I would just build on briefly to say, I think he described exactly what the central challenges in Medicaid. And I will say a little word about how Medicaid is structured and its history. So as you may know, when Medicaid was first enacted in the 1960s, it mandated that states cover a nursing home benefit. That was part of the package of mandatory services. By contrast, you may be aware that home care services were only covered in a very limited manner, only home health aid services and some of the skilled therapies. And since 1965, there has been a long curve of effort to try to build in more opportunities to receive care in the home and in the community. That's really paralleled the process of examining how we create a continuum of services based on what people need at any given moment in time, because we want that to be flexible, give choice and opportunity for an individual to have the way in which they receive services align with what they need. So I think one of the challenges is, examining the why of MFP behaving in that way. It is absolutely true that if an individual does not need nursing home level of care, that the state is obligated to start arranging for a discharge and find other circumstances for them. The reason for that is in the course of the history of the program, people only had the choice of a nursing home. So frequently, individuals who might otherwise have been served in the community went to nursing homes, and that was not their choice. So that the law said, programs, you have to examine whether someone actually needs that level of care, the very extensive services of a nursing home, and it's designed to protect people from only having that one choice. So that's the sort of why of it. But the how of what's occurring, as you said, if someone doesn't meet level of care, Medicaid actually is not permitted to keep paying for their care in a nursing home. And that's really a pretty specific and stark rule. Then we have to say, how can we intervene to support the person who continues to have needs and an interest in transitioning? And that is the piece that needs to wrap around in the way that Guy said, in terms of making that smoother process and connecting to other Medicaid services like the support from personal care assistants under Community First Choice, other programs that can wrap around that person. But I hope it's helpful to know a little bit about why that's happened, so it doesn't just feel like an arbitrary thing, like MFP doesn't care about that person.
Thank you. And Jennifer, great question. I think you all know this is an area where I'm very passionate about this. This is an area that we see all the time. So one of the things I would ask, if that was a situation that I was in, I would ask also, what is the nursing home doing? MFP is a potential resource for discharge. It doesn't remove the responsibility of the nursing home from providing discharge planning from day one. So there should be concurrent planning happening, because we don't always know or can't always anticipate what's going to happen. The nursing home would know how many days the person was approved for. Traditionally, we see 60, 90, 120, and then renewals. The nursing home should be actively working with all individuals on appropriate discharge planning with the potential resource of MFP, knowing that if they're approaching 120 days and MFP isn't quite there yet or doesn't have an apartment, they need to be co-planning and supporting that individual to ensure a safe and appropriate discharge. So I get it, and I know people hear, well, MFP pulled out. If someone's not at nursing home level of care, and they're not paying for the last day of stay, they don't want to pull out, they're required to. They're not allowed to move forward in that way. There are new programs, one, CHESS, that I would hope in that case, either the MFP staff or the nursing home staff would work with that individual to look at what other resources are available to provide stability and support for them. And then again, they always have the option of asking the regional ombudsman. I know my team does a lot of work related to these cases. And it's important for people to know that things aren't going to fall out from under them. Because what we don't want to see is someone just leave, have something happen, they end up in the hospital, and sometimes they end up coming back with a condition that's at a higher level of need. And that's what we want to avoid. So the state's worked hard, and I'm so happy with our partners, the things that they've put in place to try to provide other services that weren't available before. And that's why some of these models are, like MFP was a demonstration to demonstrate where there's some gaps, and when there's gaps, what do you do to respond to help fill in for those gaps? But it takes time. So hearing those stories, making sure they come to our attention, the attention of our other partners, so that we can intervene and we can ensure that those individuals receive high quality discharge plans is really important, but thank you. Sure.
One more thing I wanted to add. Part of the reason that I'm so honored to be here today and to listen to you all is, as we're thinking about defining what quality means and paying nursing homes for it, I'm very focused on getting the resident voice in that equation. And just as an example, and just thinking through this, if, just to echo the comment about the role of the home in discharge planning, we want to think through that. That potentially is the type of thing that, looking forward, we could include in an equality measure the extent to which a home, when clinically appropriately, successfully discharges a resident in a way that doesn't cause a hospitalization or readmission to a home. Anyway, very early stages, but I'm very much here in listening mode to think about what issues are important to you and the people you represent, so that when we're going back and thinking about how do we set up the financial incentives for homes to deliver high quality care, we're doing that in a way that's consistent with what you all are looking for. So I'll grab you after this if you have a moment left to talk more.
Okay, I see two. Tasha has one to read, and then I see if someone can go that way.
Okay. I have two questions, and this is from Lois from Avon. Question 1, for 30 beds on one side, how many nurses and nurses aides should be staffed?
That's a good question because we're hearing a lot about the staffing. So it depends on what shift, but I think the overall thing that we need to take into consideration, it needs to meet the residents' needs, and the facility needs to be looking at that. So if you have, for example, on one unit that's got 30 residents, the nursing home administrative staff really needs to take a good look at what kind of care is needed on that wing. Do you have a lot of people that are independent? That's going to change your numbers, right? Versus if you have a lot of people that require total care and some lifts. So that's up to the facility to determine what's appropriate and what's their usual staffing level. And also what we need to take into consideration, that changes as well from time to time, depending on any new admissions. What if you have a lot of people, we're getting into flu season, right? What if we have a lot of people that are sick on that unit? So that's what we need to take into consideration when we look at staffing.
Okay, and I have a second question from Dottie from Hamden. How does the resident support person differ from resident contacts, and who do we let know who the support person is? Essential caregiver, I believe. Is that the
essential caregiver?
Yep.
Right. So that is a relatively new concept that I know Mairead and I were, and where's Mr. Beam? We did Facebook Live in regards to that. So the families, if they happened to join, they got a good education in regards to the essential caregiver. So the essential caregiver should be identified by you. You need to make sure that the facility is aware of that, and whatever the facility, the mechanism, the facility decides on how they want to do that. And Mairead can jump in as well. If they wanted to start and send out notifications to you and your families as far as identifying who that is. But what we are asking is, when we're going in on survey now, the survey team is asking all of the administrative staff at your buildings, tell me about your essential caregivers. Tell me how that's being identified. Are you identifying that in your care plan meetings too? So that should be a part of your person-centered care plan. Who is identified as your essential caregiver?
Yes, and so that should be your choice. You've heard us use a couple of words interchangeably. We did move from the idea of essential caregiver here to essential support person so that we can differentiate between, you have caregivers, right? The individuals in the home who offer you care. And then you can identify the people who in your life offer you support, not only for hands-on care, but we learned throughout the pandemic how important it is that people have social and emotional support, right? So the person you identify or the people you identify can offer you more than, it can be just hands-on care, but it can also be social and emotional support. The other word that we've used is resident representative, which I think it was a little bit about that. So a resident representative can be different than your essential support person. Your representative is the person who's identified as going to make decisions on your behalf if you're not able to do so. So sometimes it's a next of kin, it's a loved one, sometimes it's a friend or a power of attorney, and other times it's a conservator. And so sometimes there's probate court involved and sometimes there's not. That's going to be on the face sheet, the first page of your medical record, so that the nursing home knows who to contact in case of emergency or to update. They should always be updating you and informing the other person as well. But then the support person, The primary and secondary are people you're going to choose that it's important for you to have day to day accessible to you to provide for whatever helps you reach your individualized goals. So does that make sense? I see some nodding of heads. Yes or no, I didn't hit it yet? Okay, yeah, okay. So that's what I'd be looking for. Who do you want to be informed and make decisions related to things? That would be your resident representative. And then who helps you meet your goals day to day? That would be your primary and secondary support person. And those, one is identified in the front of your chart, and the other two are identified in your care plan. Okay, Lindsay?
Thanks again. My name is Wadia Cowell, and this is in response to one of the panelists up there, the gentleman that mentioned about the discharge issue. My question is, I am a recipient of Money Follow the Person, and there were several issues that were not resolved. I got approved, et cetera, but the question I would like to ask is, there were many issues after my approval that the nursing home that coincided with the nursing home issues. Is there any system that's set up that they keep tabs on the discharge issues in the nursing home rather than wait until when you get to the end and find out that you have been approved to be discharged and then you can't be discharged because of whatever reasons? Because I'm going through the hearing and the fighting stage at this moment to try to get discharged because I was denied the level of care, which was not done. So there was a gap in there somewhere. Do you have a system to follow through with the nursing homes to make sure that this doesn't happen to people? Or is it that after you get to the end and you find out you can't go, then then here comes the issue. Is there steps to follow that can ensure that other people don't go through the same thing? Because I'm fighting mine.
No, and I just want to make sure I'm understanding the question. So is the challenge that you had that you were denied level of care? Just say a little bit more about the issue itself, if you would. I want to make sure.
All right, the issue is I got approved for Money Follow the Person, got the apartment, etc., signed the lease, everything. Then come to find out, my level of care wasn't done for months in advance. So there were gaps in the level of care report that was done. And so because of that, I got denied from the state the discharge. So now I'll have to fight my way out to get the discharge. But I'm saying, shouldn't there have been like red flags to the state to let them know that the level of care wasn't done?
Yeah, no, it's a great question. So what I think was going on, but I might defer to my predecessor Nicole if they want to jump in. So yes, the answer to your question is yes. This should have been caught during COVID. My understanding is that during the height of the pandemic, is my understanding that some of the level of care assessments were not done with the same regularity that they normally would be done for good reasons. We didn't want broadly more people coming into the homes than were necessary. And that has led to some challenges where issues that, I think the one that you're describing, where a person being flagged at not level of care, those issues are sometimes being caught later than they would have because the assessments were not done at the same level of frequency. My understanding, and hold me, is that we're back to doing them at the normal level, the normal frequency. And so I'm optimistic that going forward, people won't have the same challenge that you face. That sounds really tough, and I'm sorry. I hope I'm expressing empathy as well. But I suspect that the delay due to the pandemic is what's underlying your issue, though I'm not sure. Do you want to add?
Thank you. So at this time, I want to pause for a second. I do want to welcome Attorney General Tong, who has been able to join us this afternoon, and invite him up to make some brief comments and maybe join the discussion related to questions residents have about their long-term care. So welcome, Attorney Tong.
Hello, everybody. I'm sorry I'm late. I was saving the Deer Lake Boy Scout camp from commercial development in Killingworth, and then I was fighting with the airlines. But I said, guys, I gotta go. I gotta get to the AquaTurf. So it's great to be with all of you. Let me just first say thank you so much for your service, for each of your residential homes and the work that you all do on behalf of your fellow residents. I understand that all of you represent all of your neighbors and friends, and I think most of you run for your offices as presidents to represent folks. I wonder what those campaigns are like. I suspect I don't want to know. They're probably pretty rough and tumble. So thank you for speaking up and showing up for the people that you live with and share a community with. Speaking on my own behalf at the Office of the Attorney General and as your Attorney General, this is a huge priority for me in my office, making sure that all of you are heard, that the issues that you encounter every single day are addressed. We work very closely with Mairead, and I want to thank Mairead Painter for her service. So Mairead and I have a little bit of a vaudeville act. We've gone on the road to tell people about elder justice and our state's initiatives to serve our senior population and to protect all of you when there are issues. And we launched the Elder Justice Hotline, which before the Elder Justice Hotline, there were hotlines and there were places to call, but it's very confusing. If you want to reach somebody, it wasn't clear who to call, in what circumstance, or whether someone would pick up the phone. And so we now, the Attorney General's office, staffs the Elder Justice Hotline. And so you have one-stop shopping for people across the state. If you have any questions, you can call the Elder Justice Hotline. If we can help you, we will. If we can't help you, but we know who can, we'll make a phone call, put you in touch with them, and facilitate the contact. So for all of you, that number is 860-808-5555. Easy to remember, 860-808-5555. Mairead has the number. Mairead's part of our coalition. We're just there to help you with anything you have an issue with. And everything from airlines to housing or benefits, or worse, if you or somebody that you know, neighbor, friend, relative, is the victim of abuse, physical abuse, or financial abuse or fraud, that can be a very difficult, dangerous, and scary thing for people, particularly if you live in a nursing home or if you're an older American. It can be a very lonely place to be, and we want to help, and we can help. So please distribute that number where you live. Let your members know and your neighbors know that they can call us anytime. I just want to close again before I have to run off, sorry. But thank Mairead and all of you for your work, and recognize again Carol Rosenwald for her incredible service in putting this together, giving us this forum. Let me just make a promise. Next year, if we do this again, we'll make sure that it's on my calendar beforehand, and I hope you'll have me back. Thank you so much. Okay.
Well, thank you so much for being able to stop today. We do greatly appreciate it, and I will make sure I see Peter over there, and I'll make sure it's on the way advanced notice that it's on that calendar. Yeah, well, yes. Grab a Danish. There's Danishes on the, if you're looking, there's a little treat on the way out. So thank you. All right. We have time for a couple more questions if they're out there. Any other questions? You guys had a lot of questions for me this morning. What happened? I think after lunch, maybe we do this before lunch next time. I think you guys get tired after lunch. Any other questions out there? Any questions people wrote down or maybe don't want to say themselves that I can have a regional ombudsman ask? All right. Oh, John has one. Tasha? Thank you, dear. And I think Tasha came today on, she was supposed to be on vacation this week, but decided to work today to be here with you all. Thank you, Tasha.
Are there any types of programs that the facilities could incorporate to help with the staffing, like using agencies or something like that?
I know that the facilities are using staffing agencies, and I can't answer as to why a particular facility would not want to use staffing agencies. This is myself talking, that many of the challenges with staffing agencies are you like to have reliable and consistent people in the nursing homes to take care of everyone. So that could be one reason why they don't want to do that. But from what we're seeing from the pandemic and from 2020 to currently, a lot of the facilities are using staffing agencies to kind of fill in the gaps as to where they have maybe lost people and they haven't refilled the positions, or they're in the process of onboarding new staff. So that's what we're seeing as well. And many times we've seen a little bit of scheduling changes perhaps to kind of fill in the gaps as well. Maybe instead of working 8 hours, they decided to try 12 hours because that might be better for the facility based on the population and the number of residents that you have there. So we do see some kind of variations to what you would consider your typical pattern or what you've seen pre-pandemic. Yes.
John, we do use agency staff, but I'm embarrassed to tell you that our facility does not use agency staff due to payment issues. But when the agency staff is there, everybody in the house is happy. The residents, the staff, takes a lot of pressure off the staff. So things get done, showers get done, people are up and dressed for activities, appointments, family visits, etc., etc. But we can't have agency because the owner of our facility chooses not to make good on the payment plans, which is another issue altogether.
So, Patty, that was going to be part of my remarks. Actually, Kate, why don't you go first?
Yeah, I'll just very briefly, I really appreciate this question because this forum is full of powerful advocates. I want to say to you, a year ago, the Connecticut state government formed a task force on reviewing the experience of people across the state during the pandemic in nursing homes. And Mairead, on your behalf, was very strong voice saying nursing home residents had to be represented on the various committees of that work. A direct influence that many of you had in that work was on that legislation that Mairead described around essential caregivers. You had a profound influence on how legislators thought about that, the level of importance that they brought to it, and it was enacted into law. That's an incredible, powerful influence that you brought to bear. I want to urge you collectively to again assert these messages around staffing, because this is the top issue right now. It is the most instrumental matter related to your health and safety, is having enough nurses and enough nurses' aides. You have influence in sharing individual stories and raising them up, as you and Mairead have done already so brilliantly. I think you have to think about that. Folks who have raised their voices in other states, New Jersey's an example, Massachusetts is an example, have made change happen with staffing. New Jersey said the Medicaid program has to spend a certain proportion of any payment it makes to a nursing home on staffing. It said at a minimum it has to be this percentage. Massachusetts said you have to have this level of staffing and wrapped around the way they pay for nursing homes. And Guy and Nicole have talked about how they're moving to a new system to reward homes that invest more in staffing and better quality outcomes. But you have the power to offer up your own personal lived experience on a day-to-day basis. That is what legislators are going to find compelling. So I would say, what can you do? It is continue to, with many others, raise your voice around the incredible urgency around staffing, because it is a very burning bright issue.
Thank you. And John, a couple things that I want to comment on related to staffing. One is that you all should have access to a staffing sheet that is updated every shift in a place in the nursing home where all residents can see it. So if there's a locked unit, it needs to be there too. It needs to be accurately updated every shift, and that you can ask for a copy of it at any time. So can your family members. So making sure that that accurately reflects who's working in the building, first of all. Second of all, this is an area where we've talked a lot through my work with you all, through work with our family council, where we're looking for accountability and transparency. Transparency related to who is working in the building, as well as financial transparency, saying what monies are going into the building, to what Kate was saying, and then what are those dollars being spent on, and what's being taken out of the building, and having a level of accountability there. You will see that John and Patty and I and Dan Beam all have on the same color shirts today, blue. There should be some other people out there with them on, but they're not wearing them. Oh, and Andre, I see Andre with his. I'm going to encourage you all. We took a lesson out of, we took up something out of Nora and Anna's playbook, the AARP Red, the Sea of Red. So when it's time for legislative session and we're going to testify and we're going to do things, this color represents our program. If you guys can't get a shirt and you're planning on testifying, let me know. But wearing this color and then testifying on behalf of residents in long-term care communities is really important. So people start to identify that you're part of a group, right, that is seeking this change, and they'll identify that with you. And we had a bill passed. Our legislature has done a lot of great work to support you all. And one of the bills that was passed is that you have the ability to testify using a means that suits you. So if it's remotely, we can do that. And if you want to testify on a bill, I can have one of the regional ombudsmen or our resident advocates come out and help you do that. So legislative session, I know it seems early, but we're already talking about ideas and getting energy going and meeting with partners. And please watch our advocacy page on our website, which Dan Beam so awesomely keeps up to date for us. And you'll see bills that we are talking about, ideas we're proposing. We try to make sure that people are connected on how to reach out to their legislators, as well as when public hearings are coming out. We don't get a lot of notice sometimes, but it's there. And if you're interested in that level of advocacy, please let us know. We'll stay in contact with you. We'll let you know bills that are proposed. And if they do go to public hearing, we'll work with you to be able to testify and get your message out there. Okay? So with that, I think we're at the end of the day, because it's just about 2 o'clock. It is 2 o'clock on the dot. Wow, we were way on time today, people. That never happens. I want to thank all of you for taking the time to join us today, for being so attentive, and for helping me raise your voice up to the legislature, as well as our policymakers, the industry. I think it's amazing that Matt and Mag both came today to sit with us and hear what's happening, so they can bring that back to their members in a meaningful way. Our partners from AARP, I mean, we have so many partners here, all the state agencies. Thank you very much. I want everyone to take your time. Make sure your transportation is here. We want to make sure people get outside safely. Every year there's a hiccup in somebody's transportation. If there is, don't worry about it. We have never left someone here behind. We will stay until every person gets a ride back to their home of origin safely, okay? All right, thank you so much. I hope you have a wonderful afternoon.
have to fill out there, so.